The Center for the Improvement of Human Functioning International presents this luncheon lecture. Today's topic, What Children Really Need. Your presenter, Mary Braud, M.D.
Before we kind of focus on what children need, let's think about what makes for a healthy adult. Would you believe of the person that kind of just does what it takes to fit in at work, kind of not really knowing who they are, maybe cheating a little bit here or there, or maybe tolerating somebody's sexual harassment? Would you think of that person as being healthy? Would you think of that person as being a person who's on their path and bound for good health the rest of their life? If that was your child, would you be concerned to find out, And that's exactly what teenagers do that aren't on their path. Teenagers try being the skater, or try being the gangbanger, or try being the goth, because they don't know who they are necessarily. And there's a part of that that's normal and expected, but clearly kids who do that to any extreme, sort of trying on somebody else's clothes, is a kid who's not on their path and not developing well. How about, do you think you'd be okay if really you felt overwhelmed at work every day? If the task in front of you just felt confusing and you sort of felt incompetent to do it? If you knew a coworker or anyone, So what about the school child who's struggling with learning difficulties and really isn't getting it? How do you think they're doing with their development? How do you think they're doing with their health, if that's what they're facing every day at school? Kind of on the same line, can you be successful while learning freaks you out? Can you, if trying something new or doing something a little different makes you just get really scared and frozen up, are you gonna keep on succeeding, or are you gonna give up? What do you think's gonna happen to that adult, much less a child who's struggling with the same kind of things? How about worrying about being judged? Feeling like no matter what you do, somebody's not going to like it. Or no matter what you say, it's probably not going to please someone. How do you end up living? Do you end up trying to, look at people who are people pleasers? How do they live? Are they happy? They tend to get burned out. But children can start being people pleasers actually as young as 3. Children can learn that, I better make mama happy. So how is that child doing if that's the role they've taken on? And an even more serious kind of thing is not even knowing why you're here. Not feeling wanted. Not feeling accepted. Not having a purpose or meaning to your life at all. I kind of went backwards with the stages of development as I looked at all of these things, and basically these are all things that all of us should have moved through as we grew up, and we'll look at that in inverse in a minute. But I just kind of wanted to start off with, you're kind of sitting with those questions, and some of us as adults aren't doing well with these things. And our goal is, I think, in raising kids, is to make sure that they end up getting these things as they grow. For me, the picture of health, and health, remember, comes from a word that means wholeness. The picture of health just isn't that your body's okay, though that's one key component of it, that your body's balanced and healthy, but that your emotions are balanced as well. That you understand your emotions, that you're able to tolerate them and process them, that you're, not repress them, but experience them, but bring yourself back into balance with them. It's important to have connections with others in order to have health and wholeness. I believe it's important to be satisfied and happy with who you are and not what you have or what you do in order to enjoy true health. Having a sense of purpose and belonging to family, belonging to community, a sense of purpose in what you do, but not needing to do it for any kind of sense of purpose. And I believe that true health is not without a sense of being connected to something greater than yourself. What does it take to help children grow into adults who believe in themselves, who have a sense of self-reliance, but also possess a sense of belonging to something else. So they're not just independent for independence sake. Have a love of learning and curiosity about health. If we strike that out of children, we can't expect them to succeed at school. Take pride in their accomplishments and are capable of feeling, expressing, and understanding their emotions. We're going to look at some of the contributions over time of some theorists, researchers, clinicians, and neuroscience to kind of flesh out this picture and develop an understanding of children and their needs. Erik Erikson was a psychoanalyst who described phases of development as he saw it. Everybody Freud started the whole psychoanalytic movement, and everybody kind of worked out from there. And Erikson's model is one that I find helpful for looking at. So he described these phases of development that children need to move through, as well as the strengths that arise when each phase is resolved positively. And therapist Pam Levine ascribed certain powers that she believes arise from these strengths. So let's kind of take a look at those different stages as Erikson described them. Erikson said that the infant must learn trust, which leads to hope, and Pam Levine's calls that the power of being. Failure to learn trust results in mistrust of the world. The toddler develops autonomy, which leads to appropriate willpower, not necessarily the terrible twos that we sometimes think about, but a toddler who sort of has a sense that they can do something and can try something, and the power of doing. The preschooler, by the way, an absence to develop autonomy leads to shame and doubt. So think back to that person who's the people pleaser and who's not sure that they can say or do the right thing. So that insecurity about what you can do without doing something wrong. The preschooler learns initiative, which leads to purpose and the power of identity, the power of belonging to family. So preschoolers start imitating us and doing things that we're doing, and it's an excellent time to have young children start participating in family chores and contributing to family, which helps them know who they are and that they're a part of something. The school-age child must develop industry, which leads to competence. So getting back to that idea of you know what you're doing and you feel okay about trying it, and you don't feel overwhelmed by learning something new. You're willing to try to learn something new, as opposed to being certain that you're going to fail, and being certain that you're going to fail, you're probably not going to try to do it at all. And from there, the kid who's kind of going to school and doing all right, he knows he can get through life, as opposed to the child who's struggling and are probably already being told you're not going to get through life. So no wonder that he's probably doubting his ability to survive life. Another point where we could have spent the whole time talking about all the ideal activities or behaviors or ways in which a child can be given all of these things, and the ways in which a person could get derailed. And instead, my suggestion would be that you maybe spend some time just imagining a child at each of these ages. What would that child look like? A baby who's 6 months old, by the time they're 6 months and they have this in them, they know they can draw you out. They know they can engage you. They know that they can just look at you and have you interact with them. That's a baby who has that power within them. Or the toddler who, what brings to mind when I think of the power of doing in toddlers is a picture of my niece. And she's halfway dressed in dress-up. She's got a plastic shoe on one foot, and her other shoe on the other foot. She's got a little purse on her shoulder, and she's waving goodbye over her shoulder to my sister in this picture. Like, I am going somewhere. That's a toddler who knows what she's doing. Preschoolers who are proud of what they're doing, who are drawing pictures, who are participating with each other and learning to play with each other. And school-age children who like learning, as opposed to, it's just so sad to see kids as they first start school and maybe start struggling right away and don't want to go, Very different from the kid who's excited about it. The nature of development, what Erikson is, he may not have been the first person to describe development in this way, but certainly one of the people who first began studying development and referred to development as an epigenetic process, which means that the outcome of each stage then influences the outcome of all subsequent stages. So that we know that when children have experiences as infants which lead them to not develop trust in the world, that has an impact on all their subsequent development. And really we need to assist children who've had traumatic beginnings in life with a lot of the kinds of early experiences to overcome their abuse or neglect. And interestingly, the term epigenetic is now being used by, in a much broader sense, to talk about the influence of the environment on our genes. I didn't think this up on my own, but as one person put it, parents are genetic engineers. Parents are influencing the genetic expression that their children are going to have. And that's true if we think about all of us being born with enormous potential, and yet early experiences can take that potential away from us. To kind of flesh out this understanding of some important concepts that are critical in early development and therefore the rest of development, we're going to take a look at the concepts of attachment, regulation, and mentalization. So what is attachment? According to Alan Shore, a neuropsychologist, attachment is the dyadic and interactive regulation of emotion. Don't you love it when, like, one definition has more words in it that you don't know already? Or Alan Shroof's definition, the apex of dyadic emotional regulation, a culmination of all development in the first year and a harbinger of the self-regulation that is to come. So we see that attachment and regulation seem to be intertwined, and we'll examine how those two things are intertwined. Attachment was first brought to us by researcher John Bowlby, and later researcher Mary Ainsworth studied infants and developed a procedure for examining the attachment behaviors of infants. And so we see on this slide, secure, avoidant, and ambivalent were the characteristics that Mary Ainsworth developed to describe attachment behaviors. It was an experimental procedure where children and their mothers were brought into a room. They were allowed to play together. The mother would leave and return. Later on, while the mother was still out, a stranger would come in. So the baby's reaction to being left, the baby's reaction to reunion, and the baby's reaction to a stranger were studied and documented. And hence these behaviors were studied and classified. And these numbers that we see here are not from clinical populations, but these are just from general populations, where we see that at most 65% of children were securely attached, and ranging from 20 to 30% or 30 to 45% were not securely attached. At 12 months and 15 months is the approximate age that these numbers were being developed. The concept of disorganized attachment came later with later researchers, and that in particular appears in children who are victims of abuse and neglect, where nearly 80% exhibit these more disorganized, confused, kind of very erratic behaviors during this experimental procedure. Researchers later started looking at adults and their attachments. And Mary Main developed an interview where she discussed people's emotional and childhood experiences. And so we've got attachment patterns that we can look at for adults as well that go along with these child patterns. And I don't necessarily have the non-clinical numbers for the adult patterns. But let's look for a second at a little bit more about what this looks like. So if we look at the child who's securely attached, what kind of parental behavior do we see? We see a parent who's pretty emotionally available, obviously emotionally regulated, and we'll look in a second more about what regulation is. But that's a parent who knows what their emotions are, and they're able to tolerate the emotions and the experiences of their child and be supportive in an unconditional way. The child who's avoidantly attached has a parent who is non-available. And this can be for a variety of reasons. We're perhaps considering a parent who's depressed and therefore not able to consistently respond just because, of kind of their depressive inertia, and they don't get up and attend to their infant when the infant needs something. It could be the angry parent who's rejecting or hostile to some extent as they deal with the infant and try to meet their needs. The anxiously attached child has a parent who is very inconsistent, and therefore the child is never quite sure what's going to happen in their interactions with that parent. Is this the nice mom that's going to show up today, or is this the not so nice mom that's going to show up today? So they're sort of on pins and needles waiting to see what's going to happen with mom. The child who has this disorganized type of attachment has parents whose behavior is extremely erratic. Not just the slightly inconsistent, but frightening and alarming and very scary and very stressful for the child. We know from the research of Alan Shroof in particular, has studied a group of children over 30 years, a group of at-risk children from low-income families. And it's in part from his research that Dan Siegel and Mary Hartzell are able to make this claim that there's a very direct connection between how a parent and their past experiences have shaped their implicit memory, which means their nonverbal memory, and how, in the context of being with a child, those memories are reactivated. When we don't recognize these links, then these patterns of behavior are kind of reactivated automatically. We're on automatic pilot, basically, is what this is saying, when we are caring for children, much of the time. And mind you, there are some parents who know, who remember being abused or remember having very harsh parents who consciously choose to do something else. And many, many others who do not. Or many, many others who maybe, even though they do remember that their parenting was harsh, parent the same way. Not even realizing exactly what they're doing all the time. Or sometimes realizing it and not really knowing exactly how to go about changing it. And certainly for the parent who's not aware of kind of their connection to their childhood past, they are going to exist and live on this automatic pilot. And so we can see in studying generational patterns, and again, another area we're going to put out research paper after research paper, but basically abusive parenting is passed down from one generation to the next, and this is exactly how it happens. So what is regulation? In my kind of simple terms, regulation is just the ability to manage your emotional reactions. When our emotions are regulated, we have the capacity to think and consider our response to what's going on around us. And when we are dysregulated, it's our emotions that are controlling our actions and our words and our behavior. When we're dysregulated, we're surviving, and we're not living for the future. We're not living and considering the other person in front of us. Now, secure attachment, as we said, regulation and attachment go together. So secure attachment fosters regulation, but other factors can still impact how good your ability to regulate yourself can be. And the negative emotional states, frustration, confusion, feeling overwhelmed, are just some of the things that can arise for anybody as we care for small children. And your ability to stay regulated is going to control whether or not you act from that emotion and feeling, or whether or not you're able to step back, take care of yourself, and then carefully decide what action you want to take. So even the very securely attached parent can be overwhelmed at times and experience dysregulation in their behavior towards their child. And they might be overwhelmed by illness, lack of support, lack of sleep, lack of financial resources, many things, conflict with a partner, conflict at work, many things could day to day affect, for all of us, it can affect our ability to be more or less regulated. If we are securely attached, hopefully we can quickly get ourselves, deal with our stress and get back to our day-to-day pattern of being more regulated. And children who are already securely attached usually remain so if there are, the child who's securely attached at 12 or 15 months, maybe when that child is 3, another baby's born, and mom's a little tied up for a little while with doing that. Or maybe when they're 3 or 4, they move. The child who's already got this secure base can usually weather those difficulties and changes in the family environment. And Dr. Schroof's research proved that, changes in finances, other changes in the life of the child, those children were usually able to rebound and recover, as opposed to the children who have an insecure attachment from the get-go. As the family moves into greater stress or chaos, that child's going to suffer even more. And finally, this concept of mentalization, which is the ability to consider the mind of another, basically. My very simple definition of it. The caregiver's ability to have mentalization and therefore convey to their child that they are considering what's going on is what then allows the child to develop that same ability for himself to share it with others. So mentalization, we can think of it as it's the heart of empathy. The heart to take someone else's viewpoint and feelings into consideration. And again, even children as young as 2 can develop and show empathy. They may not do it consistently, but they can develop this capacity. And obviously, the more that they're shown it, the sooner and the better they'll be able to practice it. Let's venture for a second and consider what are some of the things that really happen in day-to-day life, and what are some of the things that keep secure attachment from happening more often. If there are at least 35% of people walking around who don't even enjoy this kind of secure base of life, and obviously we know that rates of mental illness and behavior problems in children are alarmingly high and rising. So what are the things that are going on that maybe impact that? I like a lot of the explanation that Alfie Kohn gives for this in his book, Unconditional Parenting. And he outlines some differences that he sees in what he calls unconditional versus conditional parenting. A lot of parenting approaches focus on behavior. How to make your child sleep, how to toilet train your child, how to make your child listen, how to make your child do homework, where we focus on what's wrong and try to fix it through things we do to our child. Whereas unconditional parenting focuses on the whole environment of the child, everything that's going on, everything that's come before, and not just this one behavior or this one moment. Conditional parenting, according to Dr. Kohn, takes a somewhat dim view of human nature in general. It's kind of like the give them an inch and they'll take a mile sort of thinking about people, or a view that basically we're bad at heart and that we don't want to do good, or that children don't want to do well, as opposed to a more balanced kind of view of, we have our good moments and we have our bad moments. We need guidance, but we're not necessarily evil at heart. I remember just being bowled over when the mother of an 8-year-old told me that she really felt like her child was antisocial. And just made me very frightened for that child. And now, of course, child psychiatry fellow. It's like my 3rd month as a child psychiatrist. And I'd just really being concerned because if that's your perception, and again, perceptions really play a big role into this, that's going to be where that woman was going to operate from. There are a lot of folks who write about parenting and behavior who aren't unabashedly, according to Dr. Kohn, talk about love as a privilege that needs to be earned. That affection and kisses and love, you don't just give that away. And certainly from the attachment disorder literature that I'm pretty familiar with, that's very much the status quo of how they write about children and what they need. And you don't just hug a child because they come up to you. You hug a child because they've done the right thing. And not to be, again, I believe love should just flow freely no matter what. And the relationship should come first no matter what. In unconditional parenting, we know that the goal is to work with the child and get to addressing the behavior, not necessarily coming up with a strategy to deal with the behavior right now. And we'll look at that a little bit further. Because a lot of parenting approaches and a lot of parenting guidance is basically behavioral approaches, which are using principles adopted from behaviorism, and when you use consequences to try to modify behavior, that's what you're doing. And it might give you pause to remember that all of that was developed with research with animals. It was not, it was like to get a chicken to peck somewhere. It was not to get a child to learn how to do algebra or to be successful in college. The thing is that they work. They do results, they work a lot of the time, and they'll get us to have good behavior, the behavior we want sometimes. But it may be at great risk to how that child feels. And particularly with very young children and the concept of timeout. Timeout was timeout from continuous positive reinforcement. Do you know of any child who's getting continuous positive reinforcement? I don't know any. And timeout to go manage your emotions when you're 2 or 3, because that's one area that timeout's used a lot. You're throwing a fit, get into timeout. Well, the 2 or 3-year-old, if they knew how to manage their emotions, they wouldn't need the timeout in the first place. And as Alfie Kohn calls it, it's solitary confinement. And actually may be worse for the child experiencing it because they don't know when it's going to end. They don't know you're going to not be mad later. The child who just gets a whack on the butt as they bawl or whatever knows it's done. The child who's been sent to timeout doesn't know when they're going to feel better, doesn't know who's going to help them get through it. And basically, it's not such a great tool when you examine it from that perspective. So, unconditional love is a pretty high goal, I have to say, It's not necessarily easy to do, but it's really that concept of being willing to walk through and do what a person needs to help shape who they're going to become over the long term. Why is it so easy for us to be automatically conditional? Because most of us have kind of been raised this way ourselves, kind of the belief that even love needs to be earned. And do you know anybody who has kind of a tit-for-tat model in their relationship? I do this and then you have to do that for me. I can't believe you're doing that after all I do for you. And as we're with our children, again, this concept of what we do is often just triggered automatically. It's just coming out of our mouths and it's happening automatically if we don't stop to consider what and why we're doing. So you might be saying, yeah, but I'm not like that. I want to do the right thing, and I set very good goals for myself, and I try to stay in control when I'm with my children. And actually, I think you have to set those goals in order to even get there. But first you have to think about setting the goals. So what happens in the moment? I love the stress model, and I've introduced this before, developed by my friend Dr. Brian Post, and it's the most simple explanation for behavior that you're ever going to see. So behavior, which is at the top here, starts off because we react to something. Everything going on in your life, everything going on around you is stress. Your body, as you're sitting here in your chair, my voice is stress. The temperature in this room is stress. The lighting is stress. Your body is reacting to all of it. And most of it, of course, your subconscious is just dealing with it and handling and adjusting your blood pressure and your breathing rate and your temperature. And you don't have to think about it, otherwise we couldn't think at all. But your brain's just kind of handling all those things. And only certain things then kind of get up to the next level of your brain and create a feeling sense. And when I'm using emotion here to talk about the basic feeling sense in your body, that kind of body emotion piece that tells you whether or not you're okay or not. And okay is love. Okay is safe. That nothing threatening is going on right now. But any degree of not safe, not okay, is fear. And when we feel okay, we all have good behavior. And when we don't feel okay, we have negative behavior. That negative behavior could be something innocuous, like screaming at the person who cuts you off in the car on the road. And hopefully you don't use too bad a word with your children in the back seat. Or it could be, could be murder. I mean, that negative behavior could be anything. But very simple model for thinking about your own behavior and for the behavior of children. And so when they're exhibiting negative behavior, it's coming from their stress and fear. It's coming from their not feeling okay. And they need help with that as opposed to a corrective action, a punishment to prevent, to make that behavior stop. And so this is definitely an encouragement to think about how do we prevent bad behavior? How do we help with stress regulation? How do we help that child not be overwhelmed in the first place? As opposed to thinking about what normal people think about is, oh, I've got a kid who misbehaves. I need to come up with the right punishment to make this stop. What this is saying is that you'll never find, and parents do that all the time. They go through punishment after punishment, tokens and charts and all kinds of consequences only to find out that so many of them don't work. No, some of them do. Again, as I said earlier, kind of that behavioral approach works some of the time. As my friend Brian Post would say, it works 90%, it works for about 90% of the kids, and then there's 10% who it definitely does work. And even for the 90% for whom it works, at least on the surface, how do those kids feel inside? What's really going on for them? How's their development really progressing? What's their relationship with their parent like? Are they angry and resentful for how their parent treats them? Are they looking to cheat and lie and get away with whatever when their parent's not looking? So that's a little bit what the stress model reminds me of. One thing that a lot of people will comment as they sort of first hear this is, well, how could, what's the stress or fear? Or, how could that be fear? But, every one of us has a unique pattern of how we react to the things in our lives. And they actually begin developing even before birth. We know that children who are born to mothers with abusive situations have high cortisol, have an abnormal stress pattern even from birth. And as we go through life, the more times we do things a certain way, the more we're going to do them the same way again. So they get activated and we do it again, and the patterns of doing it that way get stronger and stronger over time. If we intervene early for the child who has an abnormal reaction, a stress reaction, a trauma reaction to something, they're a little easier to change the younger we do it. But again, said it before, we all, as adults, we have numerous patterns related to our childhood experiences, which in particular are triggered by being with children and trying to meet their needs. But we can change these things if they're made conscious and we give them focused effort. So, what can we do? This is my very simplistic overall arching goal here. Can help parents understand development better, can study it ourselves, and share that information with parents to the best that we can. We can get focused about our parenting and create goals for our own desired behavior and really look at that. We can remember to focus on the child and not their behavior. We can develop mindfulness, and we can learn how to handle our stress in our lives. And I think the most active way to do this is to actively have some kind of appropriate, healthful relaxation practice. And that's not turning on the TV and watching and drinking a beer. I realize that is kind of vague, though. So, again, as I said, I could have gone in lots of directions on this lecture. I did kind of look at some specific things, and had all my favorite books in a pile around me as I was pulling this lecture together. Aletha Solter is a psychologist who I've had the opportunity to meet and hear her speak. And she's got a couple of books out, Tears and Tantrums being one of them. She describes crying as the process of becoming unhurt. I like that. And research actually does show us that emotional tears contain stress hormones. And emotional tears are very different from chemically induced tears. So tears are basically us discharging stress. And she, talks about that, even the infant who's had a stressful birth, or who's had a long day, or who's sleeping in a different place, or who's had a medical procedure, that they might cry when it happens, but she just talks about that maybe the baby just has a need to cry. And instead of sort of crying it out on their own, what they need is someone to take them and hold them and look them in the eye and say, it's okay to cry. I'm here with you. And maybe cry along with them, but sort of talk through that process, be there with that process. And this is a process that keeps on happening. Again, the child who gets emotional, as she talks about the broken cookie phenomenon. You don't know why your child is flipping out over the cereal being poured wrong or whatever, but you know that it's a moment where there's something up. And it may not be that moment where you can take the time to fix it, but it should alert you that this is a child that needs more closeness, as opposed to you need to stop that and, just ice it, that those emotional expressions are actually needs being expressed. Another kind of more focused way of thinking about this comes from Lawrence Kohn. And he's got a book called Playful Parenting. And in it, what he urges is for parents to just have more fun with their kids, and has a whole book of ideas reminding us that children learn through play and repetition. Children learn through going through things and actually doing it over and over again, no matter how many times you're tired. You might be tired of the same story, or you might be tired of the same game, but that's actually how children master things. That's how they develop that sense of competence. He talks about using humor to diffuse the tough moments. When a child first says no, you don't have to go through up to level 4, stop that right now. When the child first says no, just a playful no, really, can lighten it up and make things go okay. He talks about the use of playing out those tough moments, and actually talked about his daughter who was having trouble getting ready for school, and okay, play the mean daddy, and so you better hurry up and get ready. But playing that out can help the child deal with the fact that it has been rough some mornings, and then maybe develop a sense of mastery over how to deal with it. It's a very helpful book. And one thing he points out, but many other people do as well, children want time and attention from their parents more than they want anything else. It doesn't matter what you do, but just getting down on their level, doing something that they want. That's just such a gift to them. Daniel Goleman, and this is not from his book Emotional Intelligence. It's from the book Building Emotional Intelligence. He wrote the introduction to it. But we know that children who are well nurtured and who have parents who help them learn to calm down develop greater strength in the brain circuits for managing distress, as opposed to children who are victims of neglect, and not necessarily even abuse, are more likely to act on aggressive impulses and have trouble calming down when they are upset. So this is just, again, getting to that concept of regulation, that concept of the ability to take care of yourself, can be developed in children. And even if you're struggling with it as a parent first, you can start working on it together. And this book, Building Emotional Intelligence, has meditations, 2 different meditations, mindfulness and relaxation for children of different ages, and leads parents through exactly how to do it. At this point, the benefits of emotional learning, both at home and in the classroom, have been documented extensively. Improvements include better grades, better ability to calm down, higher scores on achievement tests. Daniel Goleman and others are really behind a collaboration for bringing social and emotional learning into the classroom to have it available. It doesn't have to be an either-or, but this kind of instruction can be given to our children in their classroom experiences. And then Becky Bailey's book, Easy to Love, Difficult to Discipline, is just a really lovely book, and sort of this really expands on that concept of mindfulness and gives you lots of things to be mindful of. The power of attention, to focus on what you want instead of focusing on what's not done, to focus on the fact that, hey, half the socks are picked up, or half the clothes are picked away, and praising your child or encouraging that as opposed to walking in the door and being upset about what's not done right away. The power of love to, again, to see that all of us, I think, try to do our best at all times, as opposed to seeing that, having this view of human nature as being destructive or evil. The power of acceptance, to learn how to breathe through a difficult moment and know that your anger and your frustration aren't going to help it go better from there, but accepting where things are and coming up with a positive plan. The power of perception. A lot of people don't know that they actually are in control of their own feelings. They believe that other people control them. The power of intention, to realize that, children learn through their misbehavior. It's the difficult moments and how they're managed where children learn. She uses the example of, what if you had a task at work that you didn't know how to fill out this paperwork, and your boss came in and told you you'd done it wrong and said, "No, go to the break room." And you go in the next day and you have that same paperwork to fill out, and you do it wrong, and your boss comes back to you and says, "Go to the break room." It's through this difficult behavior that they're experiencing their world. What they need for us is to walk them through it, not throw up our hands in frustration and send them away. And yes, it can be challenging. It's the hardest job on earth. I have no doubt about that. But that's the model that we have to have about it. The power of free will. This becomes, I work sometimes with parents of teenagers. And, when you've got a 16-year-old who is determined to fail, the best thing for that mom to do is to take care of herself and to feel better about herself. Because that 16-year-old is going to drag her through the mud along with him. And at that point, it's up to him. You're the one who needs to feel better. If you're struggling with your partner or your spouse, you're the one who needs to work on feeling better. Don't start pointing fingers at their bad parenting. Work on you first. Feel better first. And this isn't a feel better in a narcissistic kind of whatever happens with the kids kind of way, but work on how you're doing. And the power of unity. It's more important to be a family, to connect with others than for you to be right. It's okay to be wrong as a parent. It's okay to do the wrong thing every now and then and maybe give in or allow a privilege or, that's more important to have a connection with your child than it is to be right all the time. So I put down some of those good books that I had piled up around me while I was laid up with my leg and writing this presentation. Any and all of which are excellent resources for folks to check out. And I'll pause there for some questions. Thank you for listening. They're going to come with the microphone.
How young can an infant be to learn some of these behaviors? For example, can a newborn, when it is 2 or 3 days old, they have a bad experience, and that be related to its future personality? And I have an example if you want to hear it.
I certainly believe so. I believe birth trauma. I believe a medical procedure at 2 to 3 days of age, separations. I believe all of those things actually can have enormous impact on us for the rest of our lives if we don't have the opportunity. Basically, the one definition of trauma is anything that's unexpected, unprocessed, and unexpressed. So the 2 to 3 year old, the 2 to 3 day old doesn't have, certainly isn't expecting it, and has no means of processing it. Aletha Solter's approach of saying, let that child cry, gives them the opportunity to express. That someone says, go ahead, it was hard, holding them, looking at them, saying, it's okay to cry about this, would be one of the things that could help that child maybe get through an experience like that. But of course, lots of times that doesn't happen because we don't even, we've done medical procedures to children for a long time thinking that it doesn't matter, they won't remember, it doesn't have an impact. We know that very much that is not true. We know that even the fetus is responding to stress. I mean, some people believe that that's adaptive. That baby needs to be able to, that baby's going to be born in distress. His adrenal glands better be able to react to it. But stress in the developing brain is very destructive. And it destroys those portions of the brain that develop relationship and help that child function and help that child regulate. So it's toxic over time. Other questions?
You have addressed in order for behavior. Okay, it's real easy to kind of acknowledge the child that is coming in and just bullying his brother and sister. Maybe she is stressed, so you can kind of take her aside and figure out where, because if you're stressed in your life, you can figure that out. What do you do about the child that has the behavior of the egocentric 8-year-old, my head's in the clouds? Because, behavior modification, you were talking about, consequence behavior versus consequence. You've got a child that's like sitting there, his head's in the clouds, and he'll just eat the cheese stick and throw the paper on the floor. And you're just like looking at him going, that's the living room. You know what I'm saying? So how do you modify that behavior without having a consequence versus, bad behavior consequence thing? You point out the boundaries. So how do you turn around and see that as response?
Well, my first thought is that that's a child who's not very attentive, and it may not be attentive to very much.
Okay.
That's a skill. That's a developmental skill. And you're not going to consequence that skill into being stronger. A lot of time, inattentive children need lots of structure, lots of repetition. I mean, literally over and over and over again before they're going to get it.
Okay.
And
it's almost easier to respond to the outbreak of crying and I'll just hold you. I'm gonna let you.
Yeah,
cry.
well, yeah, that kind of gets us.
Than it is to. Some people tell me that I need to respond by just putting her in her room, let her cry it out. But I don't believe that.
Right.
I feel like I'm under stress. She's got to be under stress because we recently moved. So I'm like, I'm under stress. She's grieving.
Right.
Where it's just like you feel like you're just beating it in his head all day long. Not really literally beating it in his head, but so you just get so frustrated. You want to, but you just get so you wonder, how are you saying I probably need to just rein in the structure more? Like from the time he walks in the front door, he has to go to X, Y, and Z before he can accomplish this one thing?
Right, yeah, reminders and structures, and this is where we do this, and when you see sort of the behavior happening the way you don't want it, sort of let's step up, let's do that, let's have a do-over here, and for the, it's for the inattentive child and kind of that scattered sort of functioning brain of literally walking them through the steps of how it should look better. I've had kids who sort of run away from me, no, come back, we're going to walk to my office again, the slow way, and sort of let's do a do-over.
Do you think that is his response in just dealing with his stress? Like he's shutting down as opposed to she doesn't, he does?
It could be. I mean, if it's a new thing that's shown up since the move, it could be just a regression of that's how I'm showing my stress.
All right.
And for the 8-year-old, for the older child, talking about that out loud, 8-year-olds don't have necessarily the language for talking about how they feel.
Right.
And that's one thing, that's one concrete way of working with the verbal child, of saying, when I see you do whatever, I think it's because, you're not just, you're not paying attention, but I think it's because you just have so much on your mind. You're overwhelmed, whatever words fit for you. And that's what I think is going on. You don't say, I know, but I'm guessing, or that's what I think is going on with you.
Okay.
And provide the vehicle for maybe getting the child to open up and talking about it. They may or may not bite on that, but that's not important. Any other questions?
You spoke earlier about some new parents realizing that their childhood was not good, so they want to do something different with their children, and consequently they just go away the other way. Where can new parents find what the good median is in dealing with their kids' behavior?
If I was going to be working with somebody who is a new parent who really wanted to sort of examine sort of their past, this book, Parenting from the Inside Out, has sort of experiential exercises for going through that. But there really are lots of, I'd stay away from, again, those kind of consequent-based, this is how discipline should happen kind of books, and more books that are talking about what child development should look like and what children need at different stages, what to expect of them at different stages. For children, for parents who've been abused, again, it can be really, really difficult because, as I was thinking about, it brings up that memory of being powerless. You feel totally overwhelmed, and you don't want to. You don't want to remember. I think that's why people struggle so often in therapy. Like, yeah, I know what it's from, but I don't want to, I don't want to talk about that. And it's like, well, I don't blame you, but you have to acknowledge that that's where most of our difficulties as adults. That's where it starts from. It's from conception to 5 years. That's where our brains are formed. That's where our patterns get laid down. That's where our inner beliefs about ourselves get established. And if we're struggling as adults, it almost always ties back to early experiences. I'll give you the microphone.
So if a child has a bad experience at a young age, it's your recommendation that they should be re-examining that experience to help them learn from it, or should it be an avoided? It would really depend on, it might be something that's not a problem, but normally what children will typically want to do after a bad experience, say they got lost in the grocery store, and they're lost for 5 minutes, or just it doesn't, for whatever length of time that they think, oh my God, I'm lost. What children will typically do is tell that story over and over again, and by doing that, they're diffusing the trauma. What if it's abuse?
If it's abuse or neglect, that's obviously something that needs to be handled carefully in the appropriate, both therapeutic setting as well as the appropriate kind of parenting. Because therapy is going to happen a day a week for an hour, once a week for an hour, and life is going to happen the rest of the time. And those are children who often have extremely difficult behaviors. But I know that this kind of approach can work even with them, as far as it's not so much about you'll stop doing that, but just knowing that they're easily triggered, they're overwhelmed easily. They do all sorts of things. They hoard food, they hurt themselves, they hurt other children. They strike out at you, but when you give them a cross-eyed look, why are you so mad at me? But they need so much support and not more consequences to just make that stop.
The preceding program was presented by the Center for the Improvement of Human Functioning International in the Bright Spot for Health Lunch and Lecture Series. To inquire about additional health-related information available on DVD, audio CD, VHS, or audio cassette, simply call 316-682-3100 or drop by 3100 North Hillside in Wichita, Kansas. To discover more about the Center and what we have to offer, be sure and visit us on the web at www.brightspot.org.